Hello, I am Dr. Anagha Vaze, consultant psychiatrist at IPH Thane. Perhaps your physician has advised you to see a psychiatrist when your physical ailment isn't getting better. Or perhaps your family member or a well-wisher has suggested that you meet one. Or perhaps you yourself have given it a thought, but you are hesitant, maybe even reluctant. Myriad doubts run through your mind. Do I really need to do this? Will the psychiatrist label me as mad or insane? What if I'm given medicines that I will be stuck with for a lifetime? Or worse, will I be admitted in a hospital right away and given electric shocks? Well, let's clear some misconceptions and get rid of some fears. Let's understand what exactly happens during a consultation with a psychiatrist. A psychiatrist is a medical doctor who has specialized training in psychiatry and is qualified to treat mental illnesses. Being a medical doctor, he or she is qualified to assess physical problems and illnesses as well. Remember the psychiatrist's couch shown in movies? Where the patient lies on a couch, looks at the ceiling and talks, while the psychiatrist sits on a sofa quietly writing down some notes? Well, real consultation rooms don't look like that. Our clinics have a desk and chairs and maybe an examination table for physical examination, like all other doctors. Your first consultation with us will be of a longer duration though than most other doctors, anywhere between half an hour to 1 hour. What happens when you enter the psychiatrist's cabin? What are you supposed to say? Well, you needn't worry about that. We will ask you all the questions that are needed. Emotional distress or mental illness is not necessarily noticeable when you look at a person, the way a physical illness is. It is important to know what is happening inside your mind. And so, we psychiatrists may ask you many different questions to better understand your mood, your thoughts, your emotions, and your behavior. We will inquire about the length of time that you have faced the symptoms or changes or disturbances, about how severe they are, and about how frequently they are troublesome. This is to establish the chronology and duration, frequency and severity of the disturbance, that is, the history of the disturbance. Since our psyche does not exist in isolation, but is influenced by multiple factors and experiences, we will also ask about such things in order to understand you better within your own context. Things such as your family structure, your educational and occupational background, some further relevant psychosocial information, your medical history, and your family's medical and psychiatric history too, if any. We will also ask your family members a few questions about their observations regarding your moods, behaviors, and the history of the symptoms. During the consultation, we may ask to speak to you and your relatives separately, if we think that will be more useful. Do remember, anything that you share with us is confidential information and will stay restricted to us. Based on all this data, we will make either a concrete diagnosis or only a provisional one until a few more things can be established in subsequent visits or based on examinations and/or testing, whether physical tests or psychometric. We will establish whether you have a psychiatric disorder, that is, a mental illness, for example, depression or an anxiety disorder or psychosis, or whether it is merely emotional distress. And then comes the part that causes the worry in many of you. What exactly will the psychiatrist do next? Depending on the diagnosis we make, we will decide whether you need to be treated with medicines or only other modalities like psychotherapy, which might be familiar to you as talk therapy. Electric shocks or electroconvulsive therapy, which is the correct terminology, is a very good modality of treatment. However, It is needed in only very few severe mental illnesses. Almost all other mental illnesses are treated with medicines alone. If we prescribe medicines, we will inform you about the effects we expect and also the side effects that you may experience. We may not be able to give you a fixed timetable of the course of treatment on the very first visit, but rest assured that few require lifelong medication. We might also refer you to a psychologist or a therapist or counselor for additional psychotherapy if we so think. And there ends our first psychiatric consultation, where we hope that we have given you reassurance and some clarity about your problems, and that we will see you in subsequent follow-up visits, progressing on the road to mental well-being. I trust you no longer think that a mental health visit is an ordeal, and if need be, you will not hesitate to visit your friendly neighborhood psychiatrist. If you have found this video helpful, do like and share and subscribe to our channel. If you have any further questions, do write to us in the comment box.